All right, so we're going to go on to next steps. For the remaining 10 or 15 minutes, we are going to highlight what is upcoming. And I'll get us started thinking about what our quality improvement collaborative's next steps are going to be. So as you heard from the data overview, we're still on the struggle bus when it comes to prenatal counseling, there's plans of safe care. And while we documented terrific breastfeeding rates among eligible moms, at the collaborative level, we're still seeing a lot of variability where we have some hospitals that are near 100% and other hospitals that are at 50%. So it's this variability that we're also seeking to reduce. So we will be doing very targeted efforts at local sites. We start here and the hope is to expand to all the sites that are participating in CHoSEN. So firstly, prenatal counseling. So Danielle Smith has been leading this key driver and she's been working real closely with Camille and others at Parkview Medical Center to operationalize this counseling, really using the education videos that Parkview has created and also that Illuminate has developed. And so they have learned a whole lot through that process at Parkview, and now we're looking to expand to other sites. Breastfeeding. So Erica is spearheading this effort, and she's really focused on her own medical center, Lutheran Medical Center, and understanding what are the processes around communication of maternal eligibility from the OB providers to the pediatric providers, and are the criteria for eligibility, in fact, consistent across different areas of the hospital. So the hope is that we have a better understanding of what are some of the facilitators and barriers, and then think about expanding to the sites that have lower breastfeeding rates. Safe discharge, this is awesome work by Annie Hall, working closely with Susie Morris and others at the state level. And so this plans of safe care, we've got to figure out how do you actually operationalize it? Who is going to fill in that checklist? Who actually does the work? And so this is going to be figured out at Denver Health as well as at Poudre Valley Hospital. And hopefully we can have a quick uptake in other sites as well. And then lastly, parent engagement, patient experience. We're always striving to understand what are parents feeling, families that are affected by opioid use disorders, how are they feeling? We've heard anecdotal stories, and I've shared a quote with you earlier, but really in a more systematic way, can we understand how CHoSEN Quick has impacted the experience of families as well as providers? And Stephanie Bork is leading this effort with doing qualitative interviews of mothers specifically at Denver Health for now, and then looking to expand. And this parents or patient experience work has now expanded. You heard from Jade earlier about the data linkage project and continuing their quantitative work, but really picking up on the qualitative as well. And in a very systematic way, doing qualitative interviews of mothers and hospital staff and other providers that are really working closely with families impacted by substance use disorders. And then as always, we're looking to expand hospital participation. And we've got several in Wyoming that are already engaged, and that will continue further. We were sort of at this rapid push phase when COVID hit. And so we hope to continue that work in developing really good relationships with other sites in the Rocky Mountain area. Some more logistical things for those that are already participating and entering data. As you've heard, we are going to be updating our database. So we have these very key driver specific efforts that are happening at local sites. For those sites, when you enter data in the next few months, you'll have another set of questions that will open that's specific to your engagement within that key driver. So for instance, if you are focusing on prenatal counseling, well, there's going to be a set of process and outcome measures that are focused on just that key driver. So for instance, Parkview Medical Center, if you click on your data entry form that you are from Parkview Medical Center, you'll have a separate set of data elements that opens up. So that allows your unit to track not just the collaborative level measures, but that key driver specific elements that you will be interested in given that added effort for that key driver. We likely are going to remove the unit level practices and processes that we're asking, such as, does your unit have a breastfeeding policy in place, etc. And we'll remove the rarely answered data elements. So Blair has very astutely discovered that there are some data elements that no one really puts anything in for. So we found, why waste your time in having you even read it? So we'll get rid of those as well. So you will get an email in the next couple of weeks that summarizes all of these database changes. And so be on the lookout for that. lastly, publication. So we had a whole breakout group devoted to it, but I'm happy to announce that our collaborative level manuscript has been accepted. I received notice today and will be published in Hospital Pediatrics in the next couple of weeks. In addition, Parkview Medical Center and Memorial are nearly done in putting their manuscript together. And then we are just starting to work on our racial ethnic disparities in outcomes paper as well. So again, if you work at your specific sites or there's a certain topic that's of interest to you and you'd like to develop either a peer-reviewed manuscript or even something that you want to figure out how to communicate to your local sites, please do reach out to me. And I'll hand it over now to, let's see, do we have Jamie here? And Jamie on CPCQC next steps.
Thanks, Susan. Well, it's exciting to announce some things that I think align with what we heard today in breakout sessions and discussion. We do have some availability of resources and funding for incentives for waiver training. And so we are partnering with It Matters Colorado with some funding from OBH to actually provide incentives for you all to attend waiver training webinars. You know, we went from a in-person model due to COVID, like everything else, we're looking at online opportunities. And so we are working with some other national organizations to utilize some very specific perinatal content. And we will incentivize providers. Physicians will be $500, and then CNMs, NPs, PAs, and those level for providers will have $1,000 incentive. And so we will have informational sessions coming in the next few weeks where you can sign up, learn a little bit more about the logistics, who's available to be trained and when, what dates training will be held, and how you can sign up to take that 4-hour session and then do your independent training and be incentivized to do that. There's also some funding to support MAT process in practices, and there are funds available to help with staff training as well to support those providers that are waiver trained. So look for more information to come out from all of the partner organizations that you're hearing today. We're going to share this broadly so that we can get to the masses and get more people waiver trained so that we have more resources available for our patients. We also will be offering stigma, bias, and trauma-informed care training. Again, looking to our national partners like March of Dimes and ASAM and some other organizations for content that we will be able to offer as web series as well. And we are also working with the CDC funding that we have to provide incentives for that training for some model for champions or change agents in some of our pilot hospitals. So more information will come about those logistics, but we definitely hear that there's stigma, and we need to change the culture, and we need to provide some tools for that and do that widely across the state. So we'll start with our CHoSEN Quick hospitals and some pilot areas, and then expand that to all providers in the state. And then the other thing that we'll be doing in partnership with the Colorado Department of Public Health and Environment in response to the Maternal Mortality Review Committee's findings is looking at implementing elements from the AIM Patient Safety Bundle. And that is the Alliance for Innovation on Maternal Healthcare Program through ACOG nationally. And we are really looking to hone in on screening. And so we heard about that in a breakout session today that, you know, are people universally screening? What tools are they using? And so we want to dive into that a little further. We will be reaching out to a number of you to just ask a few questions and get a little bit more information. And we'll also be asking for a group of pilot hospitals to pretty rapidly implement the screening tool or process, whatever we decide in the next couple of weeks with your input. So there are a lot of opportunities for individuals to become involved as champions, for individuals to be trained in certain areas like waiver prescribing, and also for hospitals to be involved in our pilot, which then we will expand and make available to others throughout the remainder of the year and beyond. So a lot of national and local partnerships here, a lot of funding from different organizations really to focus on continuing to expand and grow this work. So really pleased to hear that that aligns with some of the needs that we're hearing in today's discussion. Thank you.
Great, thanks so much, Jamie. On to Jade.
Right. Thank you. I'll give a few updates on what's happening on the systems and legislature level. So the Joint Budget Committee is actually meeting as we speak. There was a new budget forecast released this morning, showing about a $3.3 billion deficit. So they're meeting today to figure out what that means for our state budget. It will absolutely impact treatment and recovery, healthcare, family planning, family support, lots of the services that we all believe are really important to help families. So we're monitoring that as we go. We should know more over the next week to two of what that will really start to look like. With that, the legislature is set to reconvene on May 26th. So they actually pushed that back a week. It was supposed to be Monday the 18th, next Monday. They pushed it back a week to May 26th. So we are getting prepared for that. We are also working really hard on that children's code change that I mentioned earlier. So that is still included in the recovery bill. There is a small fiscal note that we're trying to figure out if that's gonna stick or if that's gonna be able to be stripped to really understand if that children's code change can pass after many, many years in this very strange climate. If your hospital's legislative team is interested or if that's applicable, if you have one, we'd love to get them involved in that children's code change if that's something you're interested in. And Jillian, you see her contact information, can help direct that engagement, however makes sense. And then next slide. We're excited that we'll be together maybe in some way, shape, or form again in the fall. So we don't know, as you can imagine, what that will look like, but we do these forums biannually. So we'll be back together in the fall, and details TBD as to what that means, virtual or in person, and when and where and all of those things. So I'll turn it back over to Susan.
Great, thanks so much, Jade.